I would like to ask if Tom, Lillian, and I see Dauda is also on the call, if you can perhaps go into a deep dive as well on the work that you've been doing around testing these tools, also the process that you took when you went through the CEA and CVA checklist. So if you can just share your experiences with the group, that would be great.
Thank you, Liz, and thanks for the opportunity as well. This is much appreciated. I'm going to turn my camera on for a second to say hi, but my connection, so I'll turn it off. Hi. You can see I'm representing today. We're in the middle of testing these tools, so we're in Benway State with the branch here, hopefully running another exercise on the tool this afternoon. Turn my camera off again before I disconnect. Yeah, as discussed, I'm here supporting the testing of some of these tools and the checklist. I'm joined on the call by Lillian, the CEA Senior Officer with the IFRC here, and Dauda, and I think Mofe is also on the call sitting with Dauda with CASH and CEA in the National Society with the and we were supposed to have Gabriel joining us as well, but he's had connection issues, so I send our apologies on his behalf. Who's cashed with IFRC, so sorry for that. We have been sitting for the last few weeks here, going through the bits that we can at this current stage in the hunger crisis response and seeing what's the most useful bits to bring out. We were very lucky to have the support from the colleagues who've been speaking so far to have an early version of the CEA checklist to test out. And so what we're going to do is have a quick discussion, particularly with Dauda, from his perspective as the CASH focal point for the National Society on some of the interesting discussions that came out of going through this tool and trying to use it here. If there are any questions as we go through, please add them in the chat and we'll try and cover those as well. Otherwise, I'm just going to be pitching a few questions to Dauda and getting his fantastic responses. I would encourage my other colleagues, Morfa and Lilia, to jump in as well as we go through those. And so, okay, to launch in, I'll put this first one to Dauda, but also to Lillian. So what stage is the hunger crisis currently, for those on the call to understand what stage it is that we're trying to implement testing of this tool, and how CVA and CEA colleagues contributed to that, and then having used and been through the tool, this checklist, where would you see this fitting in well in the future? What stage would you bring it in, and where would it be most useful?
Okay, thank you, Tom. Thank you, Maya. Thank you, Elizabeth. A very quick one. My name is Dauda Mohammed, and let me put the camera on just for a few moments. Also, we are still struggling with the bandwidth, so I will turn it off and then continue discussing straight into the CEA CVA toolkit that has been x-rayed here or been talked through. For us in Nigeria, talking about the Nigeria Red Cross hunger crisis that has been implemented with the IFRC support, basically, where CVA and of course CEA, the tool that are mainly being used to actually reach out to the beneficiaries. This project is actually around the crisis that is looming in country, where so many households were displaced and a lot of livelihood are disrupted, access to school is limited, and hampering on the nutrition of the community dwellers, and at the end of the day, the rural communities actually faced with a situation of not going to the farms to actually earn their living. And that has actually initiated, or I would say formed the basis for the hunger crisis project. So far, so good. We have done registration, and we have done the first tranche of the cash distribution, trying to reach out to these beneficiaries with a multi-purpose cash grant, and of course a nutritional support also for 700 women, while the other part is looking at 5,000 women. So far so good, like I said. all these activities wouldn't be possible without the input of the CEA tool, because the community is at the center of what we do, and we try as much as possible to also give them all the strength, all the stand they needed in the project from implementation to finish. And as it is, Thomas rightly mentioned, he and Lillian are in Benue, where the PDM is happening. And we feel the tool that has been tested in the field for the CEA is in synchrony with the CEA activity, generally looking at the project cycle just as it has been presented by Maya, and of course the overview from Elizabeth. If you look at it, we can't run away from ensuring that CEA is actually in all our implementation from start to finish, talking about from preparedness, assessment, response analysis, and trying to set up the implementation. And of course, not far away from monitoring and evaluation. In the interest of time, I think I'll pause here and then we keep the discussion, and we'll be glad to also answer any other things that are not clear. Over to you, Thomas.
Excellent. Thanks, Dowda, for the introduction. That's brilliant and brings us up to date. Now I'm just going to jump into a few of the points where we had interesting discussions when we put the questions to you and we went through the checklist. And there's one I'd like to start with around assessments. Now, there's several points, and there's a bit of focus within the checklist around not doing specific CVA assessments. But this isn't, we didn't find those bits particularly relevant here, so we skipped over big chunks of that. What is it about the hunger crisis that meant we weren't, that wasn't an issue?
Okay, thank you, Tom. Looking at the minimum and of course the advanced stages of the tool, the CEA tool, CEA CVA tool we are using, it is obvious to mention to this call that for us within the hunger crisis, we try as much as possible to do a kind of, I'll call it a one-off assessment. Why? Because we run away from the fact that we don't want to bug the community with, trying to go through assessment of different sectors, considering the fact that the hunger crisis have three main sectors, talking about health, wash, and of course the livelihood component. And for us to go differently to do assessment is actually going to bore the community people. So we did a one-off thing, which is actually is tagged the general assessment, which cut across all the different thematic areas. So just to buttress the fact that we did not do just a CVA, but a holistic one that is cutting across all the thematic areas. So we call it a multi-sector need assessment that has been conducted. Yeah.
Oh, fantastic. So it was almost like we could skip some of the questions there because the approach was already a more participatory one, because it was find out what the needs and the preferences were from the community. And I was able to see very clearly in your reports that the preference was for cash as a modality across these areas. And then so you design your response based on that assumption, and cash came up at the later stage. Okay, we'll move on, because there's another aspect within assessments that was quite interesting, and that was around the interagency assessment questions and looking to conduct interagency assessments where possible. And we had a bit of a discussion as to why that's a nice aim, but rarely sort of relevant, and the limitations as to why you were able to look at doing interagency assessments. But then there was also some questions around considering it, at least in the tool, the early version of the tool, we had the advanced stage where you would consider having coordination and collaboration with interagency coordination mechanisms and things and that was perhaps not the approach you were taking, and that was much more a minimum action. Can you give us your thoughts on that one?
Okay, thank you, Tom. Generally, like we all know, coordination is actually a bedrock of every implementation. And of course, coordinating with interagency coordination is key to implementation of project. Considering the target period of this project, which is 18 months. We are more than halfway of the project. And of course, during the first phase of it, that's during the assessment, we couldn't have the opportunity of involving each and every one, because if we look at it closely, except for the Red Cross, Red Crescent movement, generally that are into virtually most, or if not all, of the sectors, you have a few organizations focusing on specific sectors. For example, the World Food Program is just looking at provision of food, and of course, Save the Children, for example, and other SOS are looking at mainly children intervention. And of course, generally, when you look at other organizations like MSF, they also look basically at just health generally. While for the Red Cross, Red Crescent movement, as I have mentioned, we look at holistic. So it is also difficult for all the intersector partnership to be in place because of such interest, and of course the catchment of most organizations. Like you all know, over the years, most focus of organization has been on the Northeast, and this project of the hunger crisis is actually taking place in the North West, North Central states, talking about where the looming crisis is actually fresh. And as we speak, I will be glad to also mention that the Red Cross, Red Crescent movement is the first to be attending to the needs of the people in this population, considering the fact that some of the scope and mandates, and of course of other interagency partners might not be looking at those areas for now. However, in the near future, they tend to key into what we are doing. That did not stop, because we try to also share whatever is happening for their information and upward comments, reviews, and also use in the future. As it is, the Ministry of Humanitarian Affairs, which is looking at the affairs of all intervention in country, is keen to use our data, including NEMA and other relevant agencies such as OCHA and the like. Thank you.
Excellent, brilliant. That's the practicalities of the checklist on the ground, and led to some really interesting discussions around these bits. I'm going to pick up one other bit here that it was an interesting discussion as to why the checklist caused us to have an interesting discussion and reflect on it, but also to have a slightly specific approach maybe for here and the context. And this was around identifying and using existing community committees. So this is one of the recommended actions in the checklist. But we had an interesting conversation that you would tend to, of course, check and monitor and understand which committees are there, but that you wouldn't always assume to use those for your primary purposes. And then you had the CRC, the Community Resilience Committees, that are used heavily here. Could you explain a little bit why about that?
Okay, as a strategy, we all know that the use of the Community Resilience Committee members, that's talking about the CRC, is keen to what we do. Why? Because even though we have our community volunteers closer to this community or living in those communities, we also want to see another parallel arm that is also checkmating what we do and try to streamline it, and also ensure that this information actually trickle down. And in so doing, we find out that there are so many committees that have been initiated or installed in those communities with different mandate and different objective. So for us, we wanted a resilience committee to help check through when we do selection of beneficiaries, and then when we program generally, to ensure that information are passed, and also to be like a first point of call when we do program. So we try as much as possible not to just use the existing committee that is available, knowing fully that they have different mandate, but we try to form committees, the CRCs in those communities, and we try as much as possible to also pick from different status, including the representative of the people in need. That's the supposed beneficiary, looking at different status such as women, because they are marginalized, and also people living with disability, and the likes, to be part of that committee, because that makes it to actually have a better weight and then the involvement, and it also helps us at the long run when we want to like implement our exit strategy at the end of the implementation. Over to you, Tom.
Thanks, Dauda. I'm aware we're kind of approaching our time here, so I've got a couple more questions for Dauda, and I'll continue a little bit, but do feel free to chop us off if necessary, Liz. Now, this one was a really interesting one, because I'm going to ask you about one of the areas where you said you used to, and our president used to answer in the yes column, absolutely we did this, but you tended to actually roll back and do this as a partially, and you had very good reasons for doing this, and this was around the sharing of key information with key stakeholders and participatory approaches to planning, and at what stage you were happy to share plans with communities, and why you were essentially a bit tentative about going too early with communities. Apologies if there's a bit of drilling going on in the background, so I'm sorry if that's coming through. Over to you, Dauda. Thank you.
Okay, thank you, Tom. For us, communication is very key, most especially, and for the existing community engagement and accountability strategy that have come to stay, we don't want to dwell away from including it in all our programming. However, when it has to do with the community information, we also try to key into the do no harm principle of not allowing our information to actually cause harm to any of the beneficiaries we are serving. In so doing, we try to like streamline the information to only people that needed it, because as it is, when you are mitigating some of these issues around the beneficiaries or the community, the people that cause havoc or cause harm to those community are also looking for such information to see how they can break the codes and also harm the beneficiaries. So we try as much as possible from the beginning not to raise hope or allow many people know what we are doing at the beginning because of such fears, not knowing who and who is actually for good. And then at the end of the day, the same information will be passed to people that are relevant in those communities to actually know them, talking about the community leaders, the traditional leaders, religious leaders, and of course, the different sector or status representative that needs to understand this. It's just all in an effort to reduce the risks that information can also do if it is widely spread, most especially to people that don't need it, looking closely also to political wills, and then people trying to also use that advantage for a different purpose. Thank you.
Oh, excellent. And this chucked up a few more interesting conversations that I don't know if we've got that much time to cover this time, Dauda, but it was brilliant to understand the links between security and CEA from this perspective. So in some respects, the ability to do more and better CEA is limited by the security constraints of the situation. And if you can improve security, you can do better CEA, but also vice versa. Security concerns that are raised because of CEA approaches, and that can be to increase or to decrease as well, because you're more welcome or your access is better. It was also like a wonderful example that you gave where you tried to do a participatory approach with a government, with a donor who came into the community, and from an accountability to donors side, they later decided after building up expectations that they weren't going to pursue this thing with the community. So the participatory approach was almost a harmful thing for that community, but not your responsibility, unfortunately. The donor decided not to. I'm going to put one more question, I think, to you, Dauda. And this was about the selecting the participatory selection criteria, and you raised a really interesting point about how important this is and how valuable it is, and there's some really good elements within the checklist on this. But around when you enter into a community, the expectations and the justifiable kind of understanding of a community about who has needs and who is vulnerable, and so how you would take a community through that process. Thanks.
Okay, basically on the selection criteria, when you first approach a community with support, virtually everybody is affected in one way or the other, depending on either livelihood or even their mental health is actually affected because of the happenings in those locations. But we also look at the possibility of other people not coping with the existing happening within those environments. And to streamline that to the best we can, and that's why we have to peg it to the selection criteria. These selection criteria are actually a kind of buttressed or imputed by the community members, and such selection criteria targets the most poorest of the poor in those communities, or people that are really in need in those communities. Everybody is in need, but you have the people that are down below the line that are mostly in need, based on the purpose that they are either marginalized, or they have lost all their livelihoods, or they have a condition like disability or age, or being aged or sick, or even the women that are always left out when it has to do with the sharing of resources. So, and of course, children, that's talking about the child-headed household. So those criteria are formulated and of course shared alongside with the community, and for them they also see reason why we are targeting the most vulnerable within the vulnerable ones that are affected, knowing fully that some people are better off as it relates to the crisis or that exists or the reason for the intervention, and their needs might also vary, knowing fully that others might only be keen to collect what ordinarily they don't even need, but we try as much as possible to share the selection criteria widely for people to actually know that this is what we're doing. And it also serves with the CEA component of it. It also serves us better because people become so keen, so interested to also see the selected beneficiaries if they fall within the criteria, and that actually help us in trying to have a better accountability. And of course the complaint response mechanism by the side also, where we receive such complaint in case anybody is actually deviating from the initial selection criteria that was set and widely shared with the community and every other stakeholder that exists within the project. Thank you.
Fantastic. Thank you very much, Dauda. I'm aware we've gone a bit over time, so we'll cut it off there. But I hope this was useful. It's certainly been a very useful and exciting exercise to run through here with colleagues, and great thanks, of course, to Lillian for facilitating all of this and guiding all of this, and to Dauda and Malfa and Gabriel as well. Hopefully this has been useful for colleagues as well to get a bit of insight into what sort of great discussions this checklist has caused when we've run through it with this operation. Handing back to you, Liz. Thank you very much.
Thanks, Tom. That was great listening to the perspectives from Dauda and how useful the checklist has been. We hope that the checklist will continue to be useful so that the CVA team and the other sectors as well that are using the different checklists understand better how to integrate CEA into their programming, into their interventions. CEA, as we know, is not standalone, should not be standalone, and it should be implemented by everyone, not just the CEA team. So we hope that the checklists will facilitate that. I don't know whether there's any questions or any inputs that you'd like to share to either myself, Maya, Tom, Lillian, or Dauda. It can be anything related to cash, to the checklist, or to the experience in Nigeria.
Liz, just a question for me. I'm just wondering, what's the expected timeline for having the checklist sort of finalised and ready for the team to start using it and rolling it out? Thanks, and great presentations, everyone. Really insightful feedback. Thank you.
Thanks, Sophie. Maya, I don't know whether you raised your hand to come in or not.
No, it's something different. Go ahead
Okay.
and answer Sophie on this.
That's fine. Well, we were just finalized, sorry, doing the first bits of feedback. So we just integrated those with Maya's support. So it should be ready for sharing soon. I'm just opening it up now to the CVA and CEA team that are on the call in case you've got any inputs as well that you want to provide on this checklist. And if so, I can integrate those, and if not, I will be sharing that soon. So I'll give you maybe a week, so by next Thursday, and then if not, I'll be sharing that then.
Yeah, maybe you can share the recording as well, Liz, when you share that. Yeah. So I had a question to the colleagues that are on the call, realizing that I think from both the CEA and CVA teams, it's quite limited. I'd really like to know what you would need from us. Masu, I'm just going to mute you. What you would need from us is in order to actually implement this at the country level. Again, seeing from the perspective that we would expect that this is a process that you go through when you are supporting on both drafts and emergency appeals, and maybe also like a general thing that you do with national societies to strengthen the CEA. So what would you need from Liz and myself to be able to go and implement this with the national societies and together as the CEA and CVA teams? Anyone?
May I please?
Yes, go ahead.
Hi, everyone, and thanks a lot for the presentation, both for the CVA and the presentation from Nigeria team. Both of them were really interesting. I think there are still so many things that we are wondering when we're going to have some opportunities to learn more, because there are still many rooms or angles that we are still very, how to say that, we are learning every day. One thing I'm asking myself, and maybe that's can be a point that could answer Maja's question, is like, many times when we are talking about the CEA or the community engagement and accountability that is related to cash, people are always saying that CEA is not really good because it's just like a way to point at someone on his responsibility, because we have this feedback tools, and many times people are thinking that if we don't integrate CEA into the CVA process, maybe there won't be any bad feedback coming from the community. So maybe in this regards, if you could have like a kind of advocacy, much more on what are the advantages of receiving feedback and also receiving negative feedbacks from community members. I mean that national society doesn't panic when they receive such a feedback, but can be able to handle it and really know how to address it, to make sure that it doesn't only create problems, but it will be always show a way to improve what we are doing in the field. That might be my point. Thanks a lot. And a hello to Dauda, always so good to have you on the board. Thank you.
Great. That's very valuable. Yeah, and indeed an issue if they don't want to take feedback. Lillian, you raised your hand as well. Go ahead.
Thanks, everyone. Thanks, Maya. Just to respond to the last question of Yali, which is very important. One of the things that we have ensured within this field testing is to let all the staff and focal points which are involved in reviewing the checklist know that we are moving towards making our work better. And so we should be open and transparent, not minding whether your response is partially or no. And it's been quite interesting that every one of them have been very open towards this, as well as now in the field in Benue State, and we've also had that briefing with them, and we can see good responses coming out, which will also document within Tom's final reports. Thanks very much. But of course, the advocacy is really necessary for us to get everyone know that we're not trying to